Good evening to each and everyone here. I am thrilled to welcome you all for today's informative webinar on Decoding Acne Management the Dermatologist Way. I am Vijay, manager at Mediversal Academy, and I have the privilege of introducing Dr. Kavita Sethi. Dr. Kavita holds MBBS, MD in Dermatology, a PG Diploma in Cosmetology, Fellowship and Observership in Aesthetic Medicine, DAC in Acupuncture, MD in Cosmetic Acupuncture, PhD in Cosmetic Acupuncture. Over to you, Doctor.
Hello, good evening, everyone. Thank you, Mediversal team, for such a nice introduction. And I would like to thank everybody for joining. I'm Dr. Kavita, and I'll be sharing my knowledge on the topic acne management. I hope you guys are aware of acne. So I just wanted to share the more knowledge what I have. So should we begin? I'll just share my slides.
Yes, please, Doctor. Thank you. We are getting replace. Yes, yes, for the question you have just. Yeah. I see doctors are all ready.
Am I audible?
Yes, doctor, you are audible. But
Is the screen is visible?
no, not as of now, doctor.
Just a second, huh?
Yeah, please.
Just a second, huh? क्या करूं?
Doctor, you can stop sharing. I'll share the screen. Doctor, you can cancel the screen sharing. I'll share the screen. Yes, doctor, you can start. Let me know when I want to change the slide. I'll change it for you.
Decode it to first slide, no? The acne part. So, hi everybody. This is Dr. Kavita. I'm a dermatologist and a cosmetologist. So, I just wanted to share my views against acne. Like what acne is. Everybody knows it, what the acne is, right? So, in my common language, I just wanted to share the things. See, please put it into the first slide. Yeah, what is acne? In a common language, I just wanted to tell you guys, acne is a common skin condition where the pores of your skin becomes blocked by hair, sebum, any oily substance, bacteria, or dead cell. Okay, those blockages produce blackheads, whiteheads, nodules, and other types of pimples. It is the most common skin condition that people experience. Like you've seen multiple people having acne with the different types, right? Estimated 80% of people age according 11 to 30, they have at least mild form of acne, and most people are affected by it same point at their lives. So now what the acne is, like acne everybody has, but it's not necessary that everybody has the same type of acne. Some have oily skin, some have poor lifestyle, some have imbalance, some have hormonal changes. There are multiple reasons of acne, right? Now we put into the second slide. Yeah, these are the causes of acne. Acne is a very common skin condition that causes pimple breakouts mostly on the face, forehead, chest, shoulders, and upper back. Right? There are a variety of causes including genetics, bacteria, excess oil production, fluctuating hormone levels, stress, high humidity, ingrown hairs, using oily or greasy products, personal care products. Like people are using the products, they are nowadays everybody has become a doctor by the social variants, right? Instagram, they see like the people are using salicylic acid, they again go for salicylic acid. But it's not that it suits their skin. Everybody has a different skin type. Everybody has a different skin structure, right? So, product with what you are used to, it doesn't mean that others are also same using the same products and they worry for it. Got it? Now the second slide, third slide, please. See, what are the different types of acne? Acne have the various varieties, right? First, it's blackheads. These are what? These are like they are open bumps on the skin with a black point when the skin is filled with the excess oil and dead cells, right? They look at if it is dirt. We do the steams during the facial, and what we do, we put the steam and we just take out the bump, right? We take out the dirt. That is actually a irregular light reflection by clogged follicles. Second, we have whiteheads, bumps that remain closed by oil and the dead skin. Thirdly, we have papules. Papules are what? Small red and pink bumps that become inflamed, right? Pustules. Pustules are the pimples containing pus. Small pimples which have pus. Like it looks like whiteheads surrounded by red rings. They cause scaring if picked or stretched. Like we have a small bump on our face, and when we pick it, when the people used to have an habit, no, whenever we have pimples on face, we used to pick it, right? It has black white heads in it, and it has a pus. You feel, no? You feel it is like the watery substances coming from that is called pustule. Now we have fungal acne. Fungal acne is what it is, the excess of yeast develops in the hair follicles. They become very itchy and inflamed. Sometimes it gets itchiness, it gets redness. It seriously irritates our skin. Then we have nodules. It's a solid pimple that are deep into the skin. They are large and painful. Now, the last one is cyst. Cysts are the pus-filled pimples. They can cause scars. This is the only thing that can cause scars. Like in the teenage, the girls have an habit, boys have an habit, just scratching, just pick the pimple, they peek it off, and then suddenly what it in the beginning it just leaves a mark, a small mark, and eventually when your age rises, it leaves a scar, right? And that scar is really very irritating when you grow up and you see the scar. This it really matters a lot. Like in the healthy lifestyle, the people are like, I have a good face, but there is a scar. So in this duration, like during the medications, nobody has that phenomena of putting only the creams and the scar get reduced. So we have multiple therapies in cosmeto, in the procedures. We have multiple things which we can go ahead. Right. The next slide, please. See, these are the stages of acne, which I told you, no? Normal follicle, it's a blackhead, whiteheads, papule, pustule, nodular cyst. So these are the stages where the acne begins. I hope यहाँ तक सबको समझ आ रहा होगा. Everybody is getting my point? If you have any problem, just put me on chat box. I'll just get back to you again. Second slide, please. Yeah. How severe can acne get? Okay. Acne is ranked by the severity. We have 4 grades in acne. First, mild. Second, moderate. Third, moderately severe. Fourth is nodulocystic acne. First, grade 1 is mostly whiteheads, blackheads with a few papules and pustules. Grade 2, multiple papules, pustules, mostly on the face. Grade 3, numerous papules and pustules along with the occasionally inflamed nodules. Okay. Grade 3, moderately severe. It might occurs on your back also, chest also, and like it seriously creates an irritation. Whenever you take bath, whenever you wear clothes, it touches your skin and it creates a blunder. Okay. Grade 4 is nodulocystic acne. It is large, painful, inflamed pustules and nodules. Next slide, please. Now, this is a differential diagnosis of acne. See, the diagnosis and the distinguished features. What is it? Bacterial folliculitis. Bacterial is what? See, when we have an acne, okay, in the male pattern when we speak about, we have an acne on face and males used to shave, right? When they shave, the bacteria, it erupts and it creates a bacterial folliculitis, right? Then we have drug-induced acne. Drug is like when the women are having the hormones problem or they are taking corticosteroids. Sorry. Yeah, when they're taking corticosteroids, then the drug-induced acne occurs. Then hydrodentitis. Hydrodentitis is what? That oral contraceptives, when we're taking iodides, when we're taking dilantin, there are multiple things when we're taking, no, the severe acne occurs. Supportativa, it's double comedones. Starts with a painful boil, like when you have, the bunch of acne, it comes on your skin and it creates pain, red inflammation, a swelling nearby. Then these are the diagnoses actually. Now the next is malaria. It's pustules and vesicles. Now perioral dermatitis, papules and pustules confined to the chin and nasobial folds. It is basically on these small areas, like on the folds, where we have folds, right? Pseudofolliculitis. It is around the vermicular border. Barbie, this is not the normal language which you guys understand. So please put up to the next slide. That we are going to understand after the acne things are getting over, no? Then we are going to understand this. Exactly, I'm going to tell you what exactly this is the distinguished features. Okay. Once we'll put up to the acne, then we'll tell you this. Because once you've gone to the acne wala part, then you'll came to know about the diagnosis. This is the last one. Yeah, please change the slide, please. See, this is the acne scars, okay? Acne scars. What are scars? I told you. Acne, when left, the things like when we pull, when we scratch, when we, in the age of teens, we get an acne, right? And we have an habit of picking it up, ice picking, when we have an habit of acting, of scratching it up, then we get acne scars, right? We have the causes, types, and the best treatment options. 15% of people are untreated acne and left with acne scars. The best treatment is acne scars is prevention, because every skin doesn't left acne scars, doesn't left with acne scars. Some of the skins are very they doesn't left with acne scars, but some of the skins are sensitive. They whenever they are getting the good exposure, when they are going with a unhealthy lifestyle, their sleep cycles are below average, so it might happen that acne get worse. And this is the only matter, like they're getting acne scars left after the untreated acne. So early acne treatments are now more effective, accessible, and affordable than ever by using a tailored set of anti-acne products suited to your skin type and severity. You can often achieve excellent results even without oral medications. But what if you already have scared red spots, brown spots, or textured scar? So we have some questions related to this acne scars, which will be given in the last of the slides. Then you easily get to know what acne scars are, what acne red spots are, what brown spots are, because every acne left substance is not a scar, right? It might be a spot, it might be a stretch mark on the face, because acne is basically a round thin up, like, but when you see the people faces, they have rectangle scar also, they have circular scar also, they have stretchy a single line scar also. There are multiple scars on the face. Next slide, please. See, types of real acne scars. It is hypertrophic acne scars. Then we have keloid acne scars. Hypertrophic is what? Raised scar that stays within the boundaries of the original pimple. Got it? It is inside the boundary, right? Where the pimple is occurring. Then we have the keloid acne scars, raised scar that grow larger than an original pimple area, often found on the chest, back, shoulders, and ears. We have treatments. We have steroid injections combined with cryotherapy, freezing, silicone anti-scar sheets, worn for months, which may reduce redness and flatten scars. Now we have ice pick scars, deep, narrow scars, 1 to 2 meter in diameter, extending into the dermis, often seen on cheeks. Treatment options include punch excision and resurfacing techniques, which usually everybody does the practice in the cosmetology, right? Next slide, please. Then we have depressed or boxcar scars. Scars with sharply defined edges and steep walls, often 1.5 to 4 diameters. Got it? Shallow scars, resurfacing or punch elevation. Deep scars, punch excretion and elevation. These days, what the guys are, everybody is planning for, they are putting into the fillers. They are doing what? They are doing the graftings and all. Like, I don't know, many therapies have came, but opt a very smooth therapy which doesn't, give any side effect in the future. Soft rolling scars, large, gently sloped scars that blend into the normal skin, often treated with subcision, which release the fibrous bands, tethering the scar. Like we have minimally invasive treatments like fractional CO2. We have microneedling. We have MNRF. We have highly effective. These are the highly effective and safe treatments. We do microneedling as well. We do PRP as well. We do the boosters for this. We have many sort of treatments. Dermabrasion we can go for. So I'll tell you the therapies. I'll tell you the oral the tablets which we can use for acne. I'll tell you the mode of treatments. But mode of treatments in the cosmetology, in the invasive way, we can go for it, and it has good results. Next slide, please. See, there are 4 types of removing acne scars. These are the normal one, like which everybody can do. The microneedling, it's the safe procedure. This treatment involves swiping and tiny needles pen over the face. Like we have derma pens, we have the microscopic needles. These processes intentionally cause microscopic skin injuries, but due to these needle puncture, the skin is forced to repair while stimulating and increasing elastin and collagen production. This is particularly helpful for acne, scared scars, skin and result to smooth out skin. Then we have chemical peels. Chemical peels, it might be for 20%, 30%, 40%, 50%, according to the acne and acne scars, according to the skin. First, we visualize the skin, which percentage we can approve, right? With the treatment, the expertly craft safe and skin-friendly chemical concentrate is applied. Like to remove the scared skin cells. With the strategic surface skin breakdown, healthy skin cells enable to optimal growth. Like we have chemical peels, we have salicylic acid, we can go for mandelic acid, we can go for, penta peels, azelaic acid, we can go for black peels, we can go for, there are multiple peels, but go with a mild one. Start with a mild one. Don't opt a very good concentration over your face whenever you have acne scars, because acne scars is the only scar, like is only the thing which we cannot treat by applying topicals. Somehow we have to go with the treatments. Next slide, please. See, we have IPL. It is intense pulse light. It provides excellent results on acne scars. This is just due to the active ability of targeted pigment lightening. So, not a very deep scars, a very mild scars, like I told you, the first one, a normal scars around his boundary. So we can get a good results, which darkens your skin structure. Like it doesn't get a hole there, but it's just like a acne spot, acne mark. We can find it easily on the face that there was an acne. That we can treat with intensive pulse light. It's like it's not suitable for dark skin tones. Like we can say, agar isse spot theek ho raha hai, then we can treat with the dark skin tones also. No, it is just to target the pigment lightening. Okay, just to treat the scar tissue area. That's it. Fourth, it's a Fraxel. It's a Fraxel laser that is pore beaming, helping to recraft the skin. It is said to feel like a rubber and band snapping against the skin along with. So these are the normal treatments which you can go ahead in the starting without going for the deep treatments. Got it? Look, Abhi, maybe you guys are not understanding it very properly because I'm not able to, hear it from you guys and I'm just speaking off. So if you have any problems, so please do let me know. I'll make you understand again, but at least write in the chat box so that I can just get to know that you guys are understanding it well. Next slide, please. See, these are flat acne marks. Okay. Flat acne marks. These are not scars. These are marks. Okay. Flat pink and reddish spot. These are caused by large capillaries and usually fade on their own within weeks or months. Then we have flat brown spots. Some fade naturally while others need treatment, such as whitening creams like we put kojic acid, tranexamic acid, we go with alpha-arbutin, and some superficial peels. Then we have persistent pink and brown spots. This can be treated using IPL, which I told you before, because it targets the capillaries and melanin to fade spots effectively. Next slide, please. See, some of the patients have the question, like at home, can we use derma roller for acne scars? Derma rollers. See, derma rollers can be only used on the scars which are, the older one. You cannot use on the active acne. Once you're using an active acne, they'll spread the bacteria and worse breakouts. So for fair-skinned individuals and depressed scars which don't have an active acne, the derma roller can help, but it can just help out. Okay, it cannot treat. So it can just help out the fibers and all. It can just help out with the scars. Ki, theek hai, you can use the serums to just apply within the scars. That's it. So, however, sun protection and whitening creams are often more effective to treat brown spots. That's it. Scars you cannot treat with this thing, derma rollers. So, I request every change the slide, please. Yeah, can I rid off red marks left by acne
Can we use
spots?
salicylic acid serum daily?
See, in the morning you can use, it depends on the skin. Whether the skin is oily, then only you can go ahead. If the skin is dry, then you can't. Then you have to use thrice a week, just on the acne
My
mark.
my skin is oily.
So an acne, like if you have an oily skin, then you can use just once a day in the beginning and just on the acne, okay? Not in the whole face. It should be spotted on the acne.
Okay.
Can I get rid of red marks left by acne spots? Post-acne red marks are caused by enlarged capillaries. These pink spots usually fade on their own within weeks. Okay, so just wait for a week. Then to speed up the process, prevent new pimples with the mild acne creams, mild anti-acne creams. Use an oil-free sunscreen every morning. Gentle face wash, gentle cleansers. What I recommend is go with the gel wala part, or you can go with the foaming wala part. Don't use cream and rub on your face on the acne so that it get worse. For persistent red marks, IPL treatments can target capillaries and fade spots faster. Next slide, please. Now, acne scar removal. Acne can be a long-term chronic condition, but even if it occurs only during the teen years, it can leave lifelong scars. Acne scars can be sunken, repressed due to the loss of tissue. They may look like ice pick pits. They can be rolling, creating a wavy texture in the skin, and they may also be the box like. There are some likes called boxcar acne scars and are often on the face. Acne scars can also be raised due to the excess tissue in the form of keloid and hypertrophic scars. They are more common on the back and chest. And acne can leave colored spots. The spots can be purplish, red, pink, and lighter skin. They can be tanned to dark brown in darker skin. These are technically not scars and will often fade over time. But you don't have to wait that they'll fade on their own. Just apply, okay? Once I suggest you the body washes has to be applied, the AHA, BHA one. You just have to go through the body washes and the proper topicals apply on the areas where you have spots, where you have acne, so that it can be cured. Next slide, please. Treatment of acne scars. Your doctor will choose specific procedures, right, to minimize your acne scars based on your health, your age, your medical history. So the severity of the scars is the main reason, like what treatment we have to choose, the type of scar, how well you handle certain medicines, treatments, therapies, your opinion or preference. Correct treatment for acne may help minimize scarring, but some procedures may help to further minimize. Once more, I just wanted to tell you everybody, acne scar doesn't have treatment like for the 100% you can't give a surety. But yeah, it can be cured till 80 to 85% with some procedures. Next slide, please. See, these are the treatments which you can proceed. Dermabrasion. It is done to minimal small scars, minor skin surfaces, irregularities, surgical scars or acne scars. It involves removing the top layer of the skin with the electrical device that scrapes, abrades the skin. As the skin heals from the procedure, the surface looks smoother and fresher. You will typically need 5 to 7 days at home to recover. Microdermabrasion is a less invasive choice, but it works less well. The treatments don't need as much downtime. Second, chemical peel. I've already told you, chemical peel are used often to minimize sun-damaged skin, irregular color, superficial scars. The top layer of skin is removed with a chemical applied to the skin. By removing the top layer, new skin reforms. This often improves the appearance. Recovery time depends on the strength of the chemical used. Then the third one is microneedling. I told you for acne scars, tiny needles are used to puncture the skin. The body makes the new collagen and elastin that helps decrease acne scars. The procedure is called collagen induction therapy. Next slide, please. See, we have dermafiller injections also. Dermafiller injections are under the skin, replace the body natural collagen that has been lost. Injectable dermafillers are generally used to treat wrinkles, depressed acne scars, facial lines. Most fillers are short-term temporary, but it lasts about 3 months, 2 years. 3 months to 2 years it works. It depends what filler you're using, right? Next, we have laser resurfacing and light therapies. Laser resurfacing using high energy light is burned away damaged skin. It may use to minimize wrinkles and fine scars. So laser resurfacing is a non-invasive procedure. It has like pulse dye lasers, which may be used to treat raised acne scars, a lighter skin people. Intense pulse light may be another treatment choice. Now we have punch grafts. Punch grafts is just like it's the last option. So I won't suggest you Abhi, but basically, which I've given you the above treatment levels, that will work good. So I don't think you have to go with the punch grafts and all because they can help to just deep acne scars, which we have a hole, major hole on the skin. Then we can go with the punch graft. Otherwise, these things are much good enough. Dermafillers, resurfacing, microneedling, dermabrasion. These works good. Next slide, please. See, these are the last one I told you. It's a surgical probe used to separate the skin and scar tissue. So this is these are the just last fall apart when you don't have any option left. A fat transfer, a surgeon can do this. Last, sorry. Right. Cryotherapy we have. Then we have topical creams. Cryotherapy, it freezes the scar tissue, causing it to die and eventually fall off. So just avoid it, right? So I just want, like, we have many procedures, but once you'll come for the hands-on, you'll get to know the major things. What the basic reason is to give the results, right? What you want, your patient should be fit and fine. What he wants, you can give him the results. So we have many therapies which we can go with and give them the results. But topical creams, these are just the maintenance. Don't think that topical cream would work on acne scars and they may prevent the things. So cream with retinoids, antibiotics, benzoyl peroxide, glycolic acid, azelaic acid, salicylic acid, they may reduce the appearance of scar, but they are not the solution. So instead of using the topical creams, they are just a maintenance. You have to go with the treatment. It is a necessity. Next slide, please. So that's all for today. I've already shared many things, but now I just wanted to know if anybody has any query.
Yeah, thank you, doctor. Thank you so much. Now we are open for Q&A session. Also, doctor has set up a quiz. We will share the quiz also on the form, on the chat box. You can answer it, and the top scorers' names will be announced at the session itself. So meanwhile, if you can able to ask any questions, chat box is open. You can start asking. Doctor, we have few questions.
Okay.
Can you access the chat box if you can? I can read it out to you. Okay. Pratiksha Gote is asking, ma'am, is there any treatment for chicken pox scars?
Good question. See, scars are scars, right? Rather it is an acne scar or it is a chickenpox scar. Chickenpox scar is also a type of acne in the beginning when it comes, right? So chickenpox scars are quite deeper. So what I told you is if they have deeper scars, we can do dermabrasion, we can do micro needling, but chemical peels, topicals, they won't work. What am I telling you is we have one procedure. Like it is my experience, what I am sharing with you. Like as I'm MD and PhD in cosmetic acupuncture also, I did this thing acupuncture, the cosmetic acupuncture, where we have needles, the silver coated needles. We prick into this thing, the scar, and we fill the exosomes inside. It gives instant result within like 3 to 4 minutes. But these are not the permanent one. Temporary, you have to take the sessions repeatedly. So we have treatments, we have multiple treatments, but it is depend on the skin, what skin type he has. If he has sensitive skin, then we don't have to opt some of the treatments. And after looking the skin only, we can decide what mode of treatment we should go for.
Yeah. Doctors, I have pasted the quiz link on the chat box. Please click on it and attend the quiz. Take the quiz. Good luck. Doctor, Twinkle Mistry, who happens to be one of our very obedient regular student, is saying good evening, ma'am. And she's also asking, please guide sunburn pigmented skin treatment.
Sunburn pigmented.
Yeah.
Okay, sunburn, I would what exactly the sunburn is. Matlab, it's a pigmented area, it's a blacker, or it is a burned wala part. Like if it is a burned wala part, then you have to first make the skin uh, soothen because it makes your skin dry and it gives a burning wala texture. So first go with the liquid paraffin creams which make your skin moisturized, and then you opt with the serums, the hyaluronic serum which moisturize your skin. Plain hyaluronic serums, just apply the serum, then apply liquid paraffin plain cream, and then go with minerals wala sunscreen, mineral sunscreens. Right, the physical one, not the chemical one. Once the skin improves, then you can go with the treatment. If you have pigmented wala part, you can go with tranexamic acid, you can go with alpha arbutin, kojic acid. But once the skin overall condition is good, then you can opt with the treatment.
Um, Samsung S25 Ultra is asking, can we use salicylic acid serum daily?
See, as I told you, if you have oily skin, it dries your skin. Salicylic acid, it makes your skin dry. So if you have oily skin, you can put it on the daily basis, but what not with the sun exposure. You have to apply the serum in the evening or in the night time just once on the acne, right? Don't apply all over your face. And then use some mild, and the serum should be the quantity of the serum, like the salicylic, the concentration should be 1 or 2% in the beginning. And if you are using it for the first time, then make it in alternate days. And if it suits, then increase the timing or increase the days. Like first we have to apply it for like 15 minutes in the starting, then increase the timing 5 minutes more, 5 minutes more. One, it is like on the basis of like half an hour, 1 hour. If it is suiting you, then you can go ahead daily. But in the beginning, make it in the concentration, lower concentration, and in the alternate days part. If it suits your skin, then you can go ahead.
Okay. Dr. Masha Nazim is asking, ma'am, salicylate face or serum will be helpful?
Sorry, repeat
The
again.
question is, ma'am, salicylate face or serum will be help? I don't know. That is the question.
Salicylic serum.
Salicylate.
Salicylamides are good for acne prone skin.
Okay.
Ceramides are good for acne prone skin, but don't make it used to of it. Okay, you can apply them, but don't be used to of it. You can apply ceramides in the night time and just once a day, and you can use it daily. But after that, you have to moisturize your skin so that skin doesn't get dry. Once the skin is dry, then you can't do anything for it.
Okay. Ramya asks, ma'am, deep-seated acne.
Sorry.
Deep-seated acne.
Deep-seated acne. Deep-seated acne, you have to go with the topicals also. Topicals, you have to go with the retinoid wala part. Retinoids like isotretinoin. You can go with the acne pits. You can go with the IPL wala part. It works good. It works wonder. It doesn't make your acne worse. Go with the procedures, and for the topicals, you can go with the like clindamycin. You can go ahead. Clindamycin, nicotinamide. You can go ahead. Nerifloxacin we have, Depson we have. We have multiple topicals. But you have to go with the retinoids also. Once a day at the bedtime.
Okay. We have Dr. Masha Nasim again asking, ma'am, is clarithromycin gel can be useful for this?
Claricinamycin, yes, cinnamycin can be done. It's claricinamide. It's the niacinamide, no?
They have written it
It's the
clarithromycin.
niacinamide based. Niacinamide can be used. It helps with acne scars also. It soothes your skin.
Okay. Pratiksha Gote is asking, ma'am, which serum is good for perioral pigmentation?
Perioral pigmentation, you can go with kojic acid, alpha arbutin.
Okay. Dr. Afnan is talking about vampire facial.
Vampire facial is good. It increases your collagen and elasticity. Whenever you are using the vampire facial is what? It is done with the dermapen. When we put the needles inside your skin, it creates your blood. It repairs the skin lobes. Okay, when we rub that blood as a facial form on your skin, it creates wonder. Like it regenerates your skin, it repairs it. It rejuvenates the skin level.
Dr. Abdul Waris is asking how to treat keloid.
Keloid has to be it has to be removed by keloid. If it is a hard keloid and it is under lobes, then you have to cure it with the superficially only, like with the cautery or with the with the subcision. This is only the treatment for that. Keloid cannot be treated with the topicals and oral medicines. So you have to go with the procedure.
Yeah. Dr. Pratibha is asking how to treat open pores.
Open pores. Got it. Open pores create dusts into your skin. So when you are using your skin routine, make sure you're using the toner every day, morning and night. AHA BHA toner works wonder. It should be applied on the daily basis.
Shekhar is asking, can NeoClean AD cause PIH?
Yeah.
Okay. Dr. Kranti Naidu from Hyderabad is asking, ma'am, when can yellow peel be used?
Yellow peel can be used when you have mite melasma, when you have sunburns, when you have depigmentation, because it creates retinol. And also you can go ahead when you have wrinkles, when you have aging, then you can go with yellow peel. Yellow peel is a lonely part with retinol, or it is mixed with any other acid that you have to see.
Okay.
It gives glow, it gives random glow, it repairs your skin. When you are in the aging, then it works wonder. Like you are uh, above 30 of age, then you can go ahead with retinol peel and it seriously gives good results.
Dr. Shruti Gupta is asking white acne bacterial treatment.
White acne bacterial, first you have to start with the bacterial tablets. The topicals, go with antibiotics, you have to go ahead. Antibacterial cream you have to apply, and make sure you don't pop it, because if the bacteria, while popping, it touches another skin level, then it creates blunder. Then it creates pus also, and it is just what we can say is ki, like once the bacteria is removed from other place, it burns on another space also. Like you cannot say ki, if it is on the same part, it doesn't recur to other part also. So it is like you have to take care of it. First, we have to go with the topicals and use the cleanser, which is antibacterial, which doesn't have any comedones.
Dr. Afnan is asking how many sittings of chemical peels required for melasma.
Minimum 3 to 5 sittings are required, and also in a gap of 21 days.
Uh, Dr. Farooq Ahmad is asking kindly elaborate more on TRT of post acne scatalization like pits and ridges over than invasive procedures, and what is the role of plastic surgery.
The plastic surgery, I'll tell you, plastic surgery is the scene. Like when you have mm, acne scars. Chalo, we take about acne scars only. We have a deep acne scars that cannot be treated by any invasive procedure. While you're doing the resurfacing, you're doing, because I told you in the beginning only, acne scars doesn't have 100% treatment. Once it is cured 75 to 80%, if a person wants smooth skin, rest 15 to 20% has to be treated by the surgery wala part. So what am I telling you is, don't ever tell your patient that acne scars will be cured proper 100%, because it can't. 100% you can't. But for the acne scar patients, the patients who are suffering from acne scars, they just want कि मैम 50% भी result मिल जाए, that is good for us. They are that too much, frustrated with those acne scars. So plastic surgery wala part, you can go ahead after the 85% when you're done with the non-invasive invasive treatment. Then you can go with the plastic surgery wala.
Okay. Manish Adev is asking a 15-year-old Asian female had acne breakout a year back. Put
Hmm.
on doxycycline for 3 months and combination of adaline and celidomycin.
Hmm.
This year again she had breakouts, blackheads, whitehead and pus. Field come down. Started benzyl peroxide face wash and combination of celidomycin 1% and isotretinoin 0.025%.
If they use topicals, then I would suggest go for antibiotics. Okay, like we have monocyclines. We have, if they have already done with doxycycline, ask them to have clindamycin oral. And isotretinoin, see, it's a long term treatment. So I won't suggest कि आप इतने छोटे बच्चे को go with isotretinoin. Isotretinoin का dose, give it for 10 mg alternate days, and on the, like, for 2 weeks, then stop it for 5 to 7 days. But for that, you have to go with the fungal treatment also, because blackheads, whiteheads, bacterial infections they are creating. So go with the fungal infection wala tablet also, only for 4 days continuously. And benzoyl peroxide, I don't think like benzoyl peroxide alone would work. Go with clindamycin, go with nicotinamide. You can use, azelaic acid also. But with the foaming face wash, if the patient is repeatedly using the face wash, that is harmful, no, because it creates, bacterial more function in the scar part also. And the thing is what I suggest is the foaming face washes, gentle cleanser has to be recommended to the patient at this age.
She has also developed rashes on left side of the face and
Rashes just
periorbital
because of
nail
face
swelling.
washes, the harsh face washes they are using.
Okay.
Ask them to use the gel wala face wash, not the gel wala, the foaming wala. Foaming face wash and the gel which they are using, it has to be soothed. Salicylic plus niacinamide gel we have, skin barrier के नाम से आता है. Go ahead. It is the coolest one. It will soothe the rashes also, and it won't act acne to occur again and again. And sunscreen, which is mandatory. I'm telling you the physical sunscreen for the sensitive skin.
Okay. Now, Dipesh Naik is asking how frequently can we use retinoids?
How?
How frequently we can use retinoids?
See, retinoids, it is a long procedure. You have to use it at least for 12 weeks continuously. But once a day has to be recommended daily. Like not more than once a day. 10, I think 10 mg is enough. Starting dose 10 mg is enough. Acetylcholine 10 mg at the bedtime.
Yeah. Ma'am, does melasma goes permanently with peels? So what is the ideal treatment for melasma?
For melasma, you have to go with exosomes also. You have to go with this thing, the non-invasive laser treatments also. But for that, being the treatment, like being into the treatment, you have to go with the this thing regular maintenance also for the skin routines. Like not doing peel is every time a solution. See, peels are good, but rapidly going, frequently going with the peel, I don't suggest. Once you're done with the peel, we have to do the combination treatments. So combination treatment works wonder. Once you're done with the peel, skin getting dehydrated. It's getting, the skin worst because peeling every time chemical peels, it somehow affects your skin. So what I suggest you is go with a combination treatment. Once you're going with the peel, another time go with the fees treatment, then you go with the laser treatment, then you go with the PRP treatment. You do the combination things and then it makes your skin fine.
Doctor, a quick announcement. The certification registration form has been dropped in the chat box. Please go and fill the form. I kindly request everyone to fill the form because the moment you fill the form, the certificates will get directly sent to your mails. Uh, Thank you. Let's move on to the questions. Dr. Abdul Waris is asking, is the treatment of keloid necessary or neglect it if there are multiples?
See, it is necessary then. Keloids, it is totally depend on the type of keloids it has. But it has to be treated, otherwise you can't even wait for the keloids ki, it grows and creates a bacteria or fungal on your body. Keloid has to be treated because once it is inside, it creates a problem. So it has to be checked up once, like what type of keloid it is.
Dr. Apeksha Sharma is asking, ma'am, Triton oint 0.25% can be used in which kind of patients? And once again, and for how long? As I have seen people suffer from redness and rashes after that.
It creates PIH also. So I won't suggest for a longer time. Tretinoin is a corticosteroid, so I don't allow कि आप उसको long duration के लिए ले रहे हो. Just put it for short time. When the uh, things are getting normal, just stop it. At least week 15 days continuously and then stop it.
Yeah. Surabhi Singh is asking alpha arbutin versus azelaic acid, which works best for PIH?
For PIH, alpha arbutin.
Okay. Uh, Seethumani's same word is asking, can you explain, is it effective using adapalene gel, azelaic acid, along with cleansing gel contained salicylic acid and glycic acid without using oral drugs, a person with acne prone oily skin?
Suffering from
Uh,
acne, prone skin.
Yes, acne prone oily skin.
Okay, acne-prone oily skin. A person, see, if it has an acne-prone oily skin, I suggest salicylic acid. I suggest azelaic acid too, but it makes your skin dry, so it's better if you're using salicylic acid. Face wash, if you're using salicylic acid, go with a niacinamide combination of the cream with the, you can go with the benzoyl peroxide, you can go with face wash, salicylic, niacinamide, you can go with the combination, which can make your skin heal and it will reverse the, acne wala part. It is going to reverse. Once the acne is there, no, you have to go with the management course also. So management, what I suggest is salicylic, azelaic, these are the best combination. And this thing, tretinoin you can use for some times. When it heals, then you can stop it.
Yeah, how to remove nail scar on face, doctor?
How to remove
Nail scar.
nail scar?
Hmm.
Again, not with the topicals. Not with the topicals. You have to go with the invasive treatments for that. We don't have any topicals which can remove that.
What are the ways of preventing acne when you have acne prone skin? And please tell me skin prep for this.
The skin maintenance is required. Proper, food habits have to take place. Proper, you have to make your lifestyle and a good version. You just have to avoid oily materials. You have to avoid, the drinks, the sugary drinks which you're drinking. And I just ask you to please have a good lifestyle with a good, diet schedules. It may randomly decrease your acne.
Uh, one second. Yeah, I have. So again, I'll be pasting the link for the certificate form. Please do go fill the form. Doctor, we have been receiving the response for the quiz. I'll be sharing the results with you in a while. Meanwhile, Dr. Vishal Kumar is asking, which is the best treatment for grade 4 acne?
See, it has to be done with the tretinoins, आपको corticosteroids. You have to go ahead. You have to go with the this thing, antibacterial part. You have to, manage it with antibiotics. Clindamycin orally, topicals, isotretinoin with clindamycin. We have a new salt, isotretinoin with clindamycin. You can apply those on the regular basis. Basically, your skin should be clean. You don't have to make a polluted skin. Sunscreen exposure is mandatory. And then again, we can go with the air bulbs. Air bulbs is a warm treatment which heats your acne and doesn't let the breakouts come. We have some procedures in this thing, cosmetology. We have many procedures, but for the time being, for the maintenance, you have to live a healthy lifestyle and you have to apply all the products which are non-cosmetogenic. Okay. And I request everybody to use the sunscreen in the 3-3-4 hours duration. So that sun exposure also creates more breakouts.
Which ointment is good for uh, chai, hyperpigmentation on cheek?
Tranexamic acid is good. Kojic acid is good. Alpha arbutin is good.
Okay. Oh, 4 days spots treatment. What I am sorry with the chemical medical words. I'm not good with it. 4 days
What?
4 days spots treatment.
What?
Yeah, FORDYCE. 4 days. I mean, sorry.
I think you spelled wrong.
FO, no, Dr. Ankita Vishwakarma, you can unmute yourself and you can say it out loud. Or the spelling is FORDYCE. Moving on to next question. Dr. Ankita, if you are there, you can send the question again, or you can unmute yourself. Doctors, you can also unmute yourself and ask the questions to doctor. Meanwhile,
Hello.
Yes,
Yeah,
Dr.
Dr.
Sethi Gupta,
Sethi.
you can ask.
I would like to ask you, when we have to use salicylic acid and when we have to use uh, mandelic acid, and when we have to use um, benzoyl peroxide, isotretinoin, and tretinoin, means all of these are for acne, but particularly when we have to use which ointment?
See, tretinoin, I don't allow you कि आप उसको daily basis पे use on the, face topicals पे. That is just the oral one. You just take it in the oral, 10 mg per day, right? Once a day. And salicylic acid you can use when you have good acne prone skin. Mild acne prone skin, salicylic acid should be, the concentration should be low. It should be
Okay.
1 or 2%. That's it. And when you have oily skin, because it dries your skin, it makes your skin dry, and it peels the white part on the skin.
Okay, ma'am.
Thank you, Dr. Shruti Gupta.
Thank you.
Doctor, you have received the results. If you can announce it, we have received so many responses. We are only announcing it on the top scorers.
Hello.
Yes, Dr. Ankita, yes, tell me. You can answer.
Yes, ma'am, I wanted to ask what is the Fortis, that Fortis spots will be there on lips now. What is the treatment for that? White color spots will be there on lips.
The yellow wala part is getting the pussy.
Yes, ma'am, it is like that somewhat.
Okay, for that though you have to rule out with the STIs, no, because it is just because of the cosmetic approvals. Because when you're using the lipsticks and all, no, it creates the harmless tiny yellowish white bumps on your lips. So these are normal, painless, but for that, you can go ahead with the fillers, and you can do what you can expose it with the sun. This thing, no, sunscreen, lip balms. Every day you have to make it hydrated, and it's better if you use exosomes on it with the derma pen, because laser surgery exists in the bothersome, but in the like before doing the treatments, before doing all these things, just apply uh, antibiotic cream, nadifloxacin. That will work.
Ma'am, is there any permanent treatment for that? Actually, from last 6 months, I'm using the same, but it is not working on one patient, so I'm
like
asking.
like on the lips, it is on the upper layer, right? When we use,
Yeah, it
where
is
we
on the
use
upper lip.
lip liner, right?
Yes, ma'am.
है ना? It is because it is from atopic subcutaneous gland. So what we have commonly, 80% of adults have the same, but when you're using the chemicals on the lips more, then it happens. So make it hydrated. Hyaluronic boosters, you can go ahead. It will hydrate, and ask the patient to use the hyaluronic serums on the lips.
Okay, ma'am. Thank you.
Welcome.
Yeah, Dr. Ankita, we are so happy that you wanted to ask something about your patient, and we would love to hear um, the results in our coming webinar. Thank you so much.
Hello.
Yes, Dr. Afnan.
Yeah, ma'am. I want to know what is the treatment for mucosal vitiligo?
Mucosal vitiligo. Like, see, mucosal vitiligo, we have many types, right? Mucosal vitiligo, आप मुझे बताओ, like, किस तरीके से वो करना चाह रहे हो आप?
And the
मतलब,
patient has a small patch on the inner lining of the lips, white patch.
it is, hypopigmentation, no?
Yeah, ma'am, kind of, but it मतलब काफी टाइम से वो treatments ले रहे हैं, but it's not getting better.
Lip fillers would work. Lip fillers would work because hyperpigmentation हो गया है, तो मेलानिन प्रोडक्शन में गड़बड़ है. You can go with, आप उसमें you can go ahead with the lip fillers.
Okay, ma'am. Any other treatment options?
Topicals doesn't work. उसमें lightening creams जाएंगी, and lightening creams have chemicals in it. Lips में फिर कहीं ना कहीं मुंह पे जाने का खतरा रहता है, तो इट इज बेटर कि आप इंजेक्शन से गो एड विद द लिप फिलर्स. और जो वो हाइपोपिगमेंटेशन है, यू कैन कलर इट ऑल्सो, बट कुछ पेशेंट्स नहीं कराते, सो गो विद द लिप फिलर्स. उसमें आप टिंट करवा सकते हो. लिप टिंटिंग कैन वर्क.
Okay, thank you, ma'am.
Welcome.
Yeah. Doctor, also Pratik is asking, please review about azelaic acid cream, ma'am, and how to use it.
Azelaic acid is good, but when you are using on the acne, it makes your acne dry, and even though it makes your acne black. So I suggest you कि आप azelaic acid use when the acne is almost about to go. Last में you can use it ताकि it doesn't leave the scar. Active acne सूख के एकदम black हो जाएगा.
हेलो मैडम, एक्ने स्कार लिए क्या करना चाहिए?
Sorry?
एक्ने स्कार, आइसपिक स्कार, स्कार्स जो रहते हैं ना, उसके लिए क्या कर सकते हैं?
आइस पिक स्कार पे आप कॉम्बिनेशन लगा सकते हैं. मतलब यू कैन डैप्सोन इज गुड फॉर इट. डैप्सोन इज एन एंटीबायोटिक. यू कैन गो एड विद डैप्सोन. अच्छा काम करेगी. और यू कैन यूज हाइड्रोटोटिनाइन टॉपिकल ऑल्सो. यू कैन यूज विद क्लेंडामाइसिन. आप उसमें नेरीफ्लॉक्सिसिन यूज कर सकते हैं आइस पिक में, ताकि वो जो स्कार है ना वो बहुत ज्यादा डिप्लॉइड ना हो जाए. मतलब अगर वो आप यू कैन डू वन थिंग. डिप्रोवेट जी करके क्रीम आता है. डिप्रोवेट जी. ओके. यूज इट विथ लिक्विड पैराफिन. Ask your patient to mix both the creams, and they can use what they can use in the morning before taking bath. 1 घंटे के लिए you can apply and then just wash the face. उससे स्किन ड्राई भी नहीं होगी, एक्ने स्कार बहुत ज्यादा इन्वेजिव भी नहीं होगा.
थैंक यू मैम.
वेलकम.
Hello.
Yes, you can ask the question.
Hello, doctor. Can we remove the nail scars through what invasive procedures?
Nail scar.
Yes.
Yeah, we can go with invasive procedures also, but इसमें you have to काम यही करेगा. इन्वेजिव प्रोसीजर्स ही काम करेंगे. टॉपिकल्स काम नहीं करेंगे इसमें.
What kind of procedures, doc?
इसमें वी कैन गो विद द आप डर्माब्रेशन कर सकते हैं. इसमें आप जैसे डर्मा रोलर होता है ना, इस तरीके का वी हैव डर्मा स्पॉट. डर्मा स्पॉट को आप नेल्स नेल्स के अगल बगल रोल करके यू कैन फिक्स इट विद द इंजेक्शन.
Okay.
फिलर्स आते हैं, उसको आप एक्ने स्कार को फिल कर सकते हैं, बट डर्मा रोलर की जगह डर्मा पोर्ट्स यूज करने हैं नेल्स के लिए.
Okay, fine. Okay, doc. Thank you.
ठीक है.
Yes, doctor. See, if anyone wants to ask, you can ask. Doctors, the results have been sent to you to your WhatsApp. If you can.
Okay. Just a second. So I would love to announce the names. Dr. Apeksha Sharma, you scored 12 out of 15. Mohammad Asif Ansari, same 12. Dr. Navneet Yadav, Dontam Sethi. Then we have Dr. Fatima Nifli, Dr. V. Kranti Kumari, Dr. Surbhi Singh, Shashi Sharma, Dr. Nandita K, Dr. Shakti Kumar Soni, Elsa Rajan Pradhanar, right? Rupjyoti Burao, Mohammad Firoz Khan, Pavan Kumar, Avinash, Dr. Nafisa. So congratulations, everybody.
Thank you.
Now I think the session gets over.
Yes. Thank you so much, doctor. On behalf of all the doctors here, I had my own personal question to ask, but anyway, I don't want to bore you with that. Thank you so much for joining. Thank you, doctors, and it's a great privilege to have Dr. Sethi here. Even as we speak, she is sitting in the clinic, speaking to us. And thank you so much, doctor. Thank you for joining this and giving us so much knowledge. and you have answered each and every questions. We had a really good Q&A session after the session class. So thank you so much.
Thank you so much. Thank you so much. And thank you all the wonderful doctors out here. If you need any help, anything, we are always there for you. So you can connect with Mediversal because I have to leave now. Thank you so much. Have a
Thank you.
great day. Bye-bye.
Bye-bye. Also, thank you so much, doctors. Engage in such kind of engagement is what drives us to do more such webinars. We had a very great month. We had around almost 10 webinars planned up on the December, and we have 3, 4 lined up, 24, 25, 27. So please do watch out on it. And Dr. Ankita, we would really love to hear the results from your patient in our coming webinar. Please do let us know. We will somehow reach it to Dr. Sethi. Thank you so much for joining all. Thank you so much. The certificates have already been sent to your email ID. Please check in your spam folder if it is not in inbox. We are trying really hard to make sure it lands on inbox, but somehow due to some technical issues that we are not which is not in our control, landing in spam. Thank you so much. Thank you for joining. Good day.